If your sciatica has come back once, it will come back again. That is not pessimism. That is the clinical pattern that the majority of sciatica patients experience when the treatment they received addressed the pain but never addressed the biological environment that keeps producing it. The stretches helped, the injections gave you weeks of relief, the medication quieted it down, and then 3 months later, 6 months later, it returned, sometimes worse than before. And there is a root, actually 2 roots, that have been used medicinally for thousands of years across multiple cultures, and that in the last 2 decades, researchers have done something those ancient practitioners never could. They have identified exactly which compounds inside these roots act on the precise biological mechanisms that drive recurring sciatica. The nerve inflammation, the muscle tension, the oxidative stress that keeps the sciatic nerve sensitized long after the original compression resolves. 2 roots every morning, and the reason almost no adult over 60 has heard this recommendation from their doctor has nothing to do with whether the science supports it. It has everything to do with how rarely nutritional interventions make it into a standard pain management conversation. My name is Dr. Michael Kent. I have spent over 20 years in medicine with a focused practice in senior health and chronic pain conditions in older adults. And today I'm going to tell you about 2 of the most clinically studied natural roots available for the specific inflammatory and neurological mechanisms that make sciatica not just painful but chronically recurrent. And I am going to tell you exactly why, when used correctly and under appropriate medical guidance, adding these to your morning routine may change the pattern that has been defining your life for months or years. Comment your age and your city in the comments right now. I read every single one. I want to know who is watching this and where in the world adults are living with sciatica that keeps coming back no matter what they do. Drop your age and city below and subscribe to this channel so you do not miss what I publish every single week. Let me start with something that most sciatica patients have never been told clearly enough, because without understanding this, the 2 roots I am going to describe will seem like simple remedies for a simple problem. They are not. They are targeted natural interventions for specific, well-characterized biological processes. And understanding those processes is what separates someone who takes a supplement hoping it helps from someone who understands exactly what it is doing inside their body and why consistency matters more than anything else. Sciatica is almost universally discussed as a structural problem, a compressed nerve, a herniated disc pressing on the sciatic nerve root, a tight piriformis muscle, a narrowed spinal canal. And the structural picture is real. It is a legitimate starting point for understanding why the pain begins. But here is what the structural model does not explain. It does not explain why 2 people with identical disc herniations on MRI have completely different pain experiences. It does not explain why one person recovers fully in 6 weeks while another carries the same diagnosis for 3 years. And it does not explain the most frustrating pattern of all, why sciatica that seemed to resolve comes back repeatedly in people who are doing everything they were told to do. The answer to all of those questions lies in the inflammatory environment surrounding the sciatic nerve. When the nerve is compressed or irritated, the body's immune system sends inflammatory chemical messengers to the site: prostaglandins, cytokines, tumor necrosis factor, interleukins. These compounds sensitize the nerve, lower its pain threshold, and create a chemical environment in which the nerve fires pain signals far more easily than it should. In many people, particularly adults over 60 with diets that favor inflammation, with chronic stress, with certain nutritional deficiencies, and with the general shift in immune regulation that accompanies aging, this inflammatory response does not resolve cleanly when the structural compression stabilizes. It becomes self-sustaining. The inflammatory environment keeps the nerve sensitized. The sensitized nerve keeps generating pain. The pain generates stress and altered movement patterns that perpetuate the inflammation. And the cycle runs independently of what is happening at the disc or the spine, which is exactly why structural treatments alone produce incomplete and temporary results for so many people. Addressing that inflammatory environment, specifically reducing the biological substrate that feeds the chronic neuroinflammatory cycle, is where Devil's Claw and Boswellia enter the picture with genuine and specific clinical evidence behind them. These are not interchangeable. They do not work through the same mechanism. And that is precisely why combining them under appropriate medical guidance addresses the inflammatory cycle at 2 different biological points simultaneously. Devil's Claw is a root native to the Kalahari Desert region of southern Africa. Its name comes from the appearance of its fruit, covered in hook-like projections, but the medicinal part is the root, which contains a group of compounds called iridoid glycosides, with harpagoside being the primary active constituent. Harpagoside has been the subject of multiple peer-reviewed clinical trials specifically examining its effects in musculoskeletal and nerve-related pain. The mechanism is well characterized. Harpagoside inhibits the production of prostaglandins and specific inflammatory cytokines, including COX-2, the cyclooxygenase enzyme that is the primary target of most anti-inflammatory medications, and several downstream inflammatory mediators, including tumor necrosis factor alpha and interleukin-1 beta, both of which are directly involved in the sensitization of the sciatic nerve in chronic sciatica. What makes Devil's Claw particularly relevant for recurring sciatica rather than just acute pain is the nature of its anti-inflammatory action. Research has shown that harpagoside's inhibition of the inflammatory cascade is not limited to a single pathway, but affects multiple upstream and downstream points in the inflammatory signaling chain simultaneously. This broad-spectrum anti-inflammatory action means it is addressing the chronic low-grade neuroinflammation that sustains the recurring pain cycle, not just the acute inflammatory response that follows a flare. Multiple clinical trials in patients with lower back pain and sciatica-related conditions have found statistically significant reductions in pain scores and improvements in mobility with Devil's Claw supplementation compared to placebo, with effects becoming most pronounced after 4 to 8 weeks of consistent daily use, consistent with an intervention that is changing the underlying inflammatory environment rather than simply masking the symptom. Boswellia, known in Ayurvedic medicine as shalaki, and derived from the resin of the Boswellia serrata tree native to India, works through a different but complementary mechanism. The active compounds in Boswellia are boswellic acids, particularly ACOBA, acetyl-11-keto-beta-boswellic acid, which has been identified as a potent and specific inhibitor of 5-lipoxygenase, an enzyme that produces leukotrienes. Leukotrienes are a class of inflammatory mediators that are distinct from the prostaglandins targeted by Devil's Claw and by standard NSAIDs, and they play a particularly significant role in the neuroinflammatory environment specific to nerve pain. While COX-inhibiting compounds address one branch of the inflammatory cascade, 5-lipoxygenase inhibition through Boswellia addresses a parallel branch that COX inhibitors do not reach. This is why Boswellia and Devil's Claw together provide a more comprehensive anti-inflammatory effect than either alone. They are not redundant, they are complementary, each closing off a different route through which the chronic inflammatory environment sustaining sciatic pain maintains itself. Boswellia has also been shown to have a specific additional mechanism relevant to nerve pain. It inhibits the breakdown of glycosaminoglycans, the compounds that form the structural matrix of cartilage and connective tissue. In the context of the spinal structures surrounding the sciatic nerve roots, this translates to a protective effect on the tissue integrity of the intervertebral discs and surrounding connective tissue, meaning Boswellia may be doing something meaningful not just for the inflammatory environment around the nerve, but for the structural environment in which the nerve sits. Research in patients with osteoarthritis, lower back pain, and nerve-related pain conditions has consistently found Boswellia to produce significant reductions in pain intensity and improvements in functional mobility, with effects building over 6 to 12 weeks of consistent daily supplementation. Now, I want to tell you about Ron. Ron came to see me at 63 years old. He had been dealing with sciatica on and off for almost 5 years, right-sided, originating in the lower back and radiating down through the back of his right thigh to just below the knee. His MRI from 2 years earlier had shown a moderate disc bulge at L4, L5, and some facet joint degeneration consistent with his age. He had been through physical therapy twice, had received one epidural steroid injection which gave him significant relief for approximately 8 weeks, and had been managing with ibuprofen and naproxen during flares for the better part of 3 years. What brought Ron to me specifically was the pattern. The sciatica would settle, sometimes for 2 or 3 months at a time, and he would begin to feel like he had turned a corner. He would go back to walking, back to the light gardening he loved, back to the version of his life that felt normal. And then something would trigger it. A longer car journey, a disrupted sleep week, sometimes nothing identifiable at all, and it would come back. He told me the returns felt personal, like his body was waiting to punish him for assuming the good period would last. When I looked at Ron's full picture, several things stood out. His diet was heavily weighted toward processed and convenience foods, high in refined carbohydrates, and almost entirely absent of the anti-inflammatory nutritional inputs that might reduce the chronic low-grade systemic inflammation feeding his sciatic flare cycle. His omega-3 intake was minimal. He drank alcohol regularly, which contributes to systemic inflammation and disrupts sleep quality, both of which are relevant to the sciatic pain cycle. And he had never, in 5 years of managing this condition, had a single clinical conversation about nutritional or botanical anti-inflammatory approaches. Every conversation had been about the disc, the nerve, the injection, the medication, never about the inflammatory environment in which all of those things were operating. We built a plan together, carefully, with the involvement of his GP, who reviewed his complete medication list before anything was introduced. Ron was on a low-dose aspirin for cardiovascular protection, which required attention given that both Devil's Claw and Boswellia have mild antiplatelet properties and needed to be introduced with appropriate monitoring. With his physician's guidance and agreement, we introduced a standardized Devil's Claw extract at an evidence-supported dose each morning alongside a Boswellia extract standardized for AKBA content. We also made 3 dietary changes, reducing the processed food load that was consistently fueling his systemic inflammatory baseline, adding 2 portions of fatty fish per week, and replacing his cooking oil with extra virgin olive oil. Simple changes, achievable changes, but changes that address the inflammatory environment from multiple directions simultaneously. Ron was consistent in a way that I think came from finally understanding the mechanism. When patients understand why something works biologically, not just that someone told them to take it, they follow through differently. He told me at his 8-week check-in that he had not had a full flare since starting, that the background ache that had been a constant companion for years had genuinely quieted, that he had completed a full day of light gardening the previous weekend, something that would reliably have triggered a flare before, and woken the next morning feeling stiff but not in the shooting, radiating pain he had come to expect. At 16 weeks, his GP noted at a routine review that Ron had not requested a repeat NSAID prescription for the first time in over 2 years. Ron was not cured. His disc bulge was still visible on imaging. The structural picture had not changed. What had changed was the inflammatory environment in which that structure sat, and that change was enough to shift the pattern from a cycle of recurring debilitating flares to a manageable condition that he felt he was genuinely participating in controlling. Let me give you 5 specific things to bring to your physician before you do anything else with this information. The first is to ask for a full medication review before introducing either Devil's Claw or Boswellia. Both compounds have mild antiplatelet and anti-inflammatory properties that are relevant if you are taking blood thinners, aspirin, or other anti-inflammatory medications. This is not a reason to avoid them. It is a reason to introduce them under appropriate clinical oversight. Your physician needs to know your complete medication list. The second is to ask specifically about standardized extracts. Not all Devil's Claw and Boswellia products contain meaningful therapeutic amounts of their active compounds. For Devil's Claw, look for products standardized to harpagicide content. Research-supported doses have typically used extracts standardized to a specific harpagicide percentage. For Boswellia, products standardized for AKBA content are the ones with the most direct clinical evidence behind them. Your physician or a qualified nutritionist can guide you toward appropriate standardized formulations. The third is to set a realistic timeline. The anti-inflammatory effects of both Devil's Claw and Boswellia are cumulative. They build as the inflammatory environment around the nerve gradually shifts over weeks of consistent daily use. Research has consistently shown that the most significant effects emerge between 6 and 12 weeks. If you introduce these supplements expecting dramatic change in the first 2 weeks and discontinue when you do not see it, you are stopping before the biological process has had time to complete its work. The fourth is to address the dietary inflammatory load alongside supplementation. Introducing anti-inflammatory botanical supplements while continuing a diet high in refined carbohydrates, processed oils, sugar, and alcohol is working against yourself. The supplements reduce inflammation through specific pathways. The diet either supports that reduction or constantly refuels the inflammatory fire that the supplements are trying to put out. Both matter and they work synergistically. The fifth is to continue the physical rehabilitation work that addresses the structural component of your sciatica alongside the nutritional work that addresses the inflammatory component. Specific exercises that strengthen the deep spinal stabilizers and the hip external rotators, the muscles that protect the sciatic nerve from repeated compression, are not optional. They are the structural layer of a multi-layered approach. Devil's Claw and Boswellia address the inflammatory layer. Movement and strengthening address the structural layer. Both are necessary. Neither alone is sufficient for lasting change in a chronic recurring condition. Sciatica that keeps returning is not a life sentence. It is a pattern driven by a chronic inflammatory environment that has never been directly addressed, compounding the structural vulnerability that is already there. Devil's Claw and Boswellia are not miracle roots. They are two of the most specifically researched natural anti-inflammatory compounds available, with mechanisms that directly target the biological drivers of recurring sciatic pain at price points that make them accessible to almost anyone. Ron found out what they could do when combined with the right dietary support and the right medical oversight, and his story is not unusual among the patients I have seen make meaningful progress with chronic sciatica after years of partial solutions. I am Dr. Michael Kent, and this channel exists because every adult over 60 managing recurring pain deserves access to the full picture of what their body needs. Not just the part of the picture that fits into a standard appointment, but the nutritional science, the botanical research, and the practical framework that allows them to walk into their next medical conversation as an informed participant rather than a passive recipient. Scroll down right now and leave your age and your city in the comments below. Just those two things. I read every single comment and I use that information to understand where in the world people are living with chronic pain that has never been fully addressed and what conversations this channel needs to be having next. And if you are not already subscribed, please subscribe right now. Every single week, I am publishing content built specifically for adults who are serious about their health after 60 and who want something real, something grounded in evidence, something they can actually bring to their doctor and use. Subscribe so you do not miss what is coming. I will see you in the next video. This video is produced by Dr. Michael Kent for general educational and informational purposes only. Nothing presented in this video constitutes medical advice, clinical diagnosis, or a recommendation to start, stop, or modify any medication, supplement, dietary regimen, or treatment plan. All content is intended solely to support informed conversations between viewers and their qualified licensed healthcare providers. Sciatica and related nerve pain conditions have multiple potential causes and vary significantly between individuals. Devil's Claw and Boswellia supplements may interact with certain medications, including blood thinners, anti-inflammatory drugs, and antiplatelet agents, and should not be used without prior consultation with a qualified healthcare provider. Individuals with gallstones, gastrointestinal conditions, or who are pregnant or breastfeeding should consult their physician before using either supplement. Always consult your physician, pharmacist, or licensed healthcare professional before making any changes to your supplement regimen or diet. The patient experience referenced in this video is presented in a generalized, non-identifying, illustrative format for educational purposes only. It does not represent a guaranteed outcome, a typical clinical result, or an endorsement of any specific supplement brand or dietary product. Dr. Michael Kent does not endorse any specific supplement brand, pharmaceutical product, or commercial health service. References to research findings in this video are presented for general educational context and are not a substitute for individualized professional medical guidance. If you are experiencing worsening sciatica, new neurological symptoms, loss of bladder or bowel control, or any other concerning symptoms, seek medical attention promptly. If you are experiencing a medical emergency, contact your local emergency services immediately. This content is not intended to diagnose, treat, cure, or prevent any disease or medical condition. See Dr. Michael Kent, Senior Health Education, for educational purposes only.